Hi everyone. I am Bismi Palati. I am sharing this wonderful news from 88.9 FM on my favorite show, Dominus Nisi. Today, I'm so overwhelmed and grateful to hear the great news of a launch that's happening. And it's already happened today. But I would love to share that news with all the Indian people because this is specifically for Indian community. It's really a great help for mothers. And those two reasons are really connected to my heart because I am an Indian born first generation Australian who was looking forward to become a mother for almost 9 years. And I was fortunate to have a baby ninth year with a very rigorous treatment. My doctor chose to have my baby in Werribee Mercy, even though I was having treatments in different places. And my baby was born during a C-section in Werribee Mercy around 17 or 19 years ago. And that time, the opportunities or the facilities over there was just starting to flourish, and there was a small wing of rooms, and there is a high need of very specific rooms because we can see at that time the neonatal was really small and it was almost full, and at the same time, the maternity ward was almost full all the time. And then you may not get the best room sometimes if it is the time of like a many complicated deliveries. You may need to sacrifice with different varieties of issues. I was fortunate to have a room for one day, and then I had to change to another day, and then I had to run around with the different places. It was because of your ability, like an availability of the facilities at that time. So things changed a lot. And at the same time, the number of Indians or number of people having birth at Mercy is also tremendously increased. So what is happening now in the health sector is to putting lots of money into because the government, the community is really in high need of putting many things into the community. But what is happening with this wonderful program this Werribee Mercy Hospital is doing? So this is from Werribee Mercy Health Foundation. Mark is the partnership manager who is really taking courage to help the Indian community. So I would love to share this to the wide audience. I already shared with the many different Indian community leaders about this because the launch of this particular program with the fundraising event was today. It happened from 11:30 to 2:30 p.m. today at a Marquee Lansmore Mansion Hotel in Werribee with many different distinguished guests. So the launch, what is that launch for, or what is the specific program? So that's what I'm going to share with you. So Mercy Health Foundation's Mother's Day launch, that was the launch that I was talking about that happened today at Lansmore Mansion, Werribee. So this is actually bringing together the community leaders and supporters to share an exciting new project, the launch of Wyndham's first community maternity hub. So we know that the community need a place where we put all our energy when we will be receiving our new baby. So we need an high-end energy and support and compassion. And that's what Werribee Mercy Health Foundation is doing with this. Yes, First Community Maternity Hub. Borrowing from Queensland's health experience, the Mercy Health is actually opening a community a hub which will be bringing maternity services close to home. Many mothers don't feel confident to come into the hospital, and especially from the multicultural background. So the maternity hub will be bringing different ideas for this issue. There are different ethnical areas, or the ethnical way of giving birth to babies. There are different rituals that they used to do during this pregnancy and delivery. And when we come here as a migrant, it's always hard to continue or practice those ones, which they believe that that may impact their generation. So the Indian community is the largest growing migrant group in Wyndham, but unfortunately, Indian born mothers in Australia are at increased risk of induced labor, emergency C-section, and preterm birth, especially between 20 to 27 weeks. And babies with very low birth weight and gestational diabetes and hypothyroidism and iron deficiency, anemia, and vitamin B12 compared to other women's in Australia. So I can be the real evidence. My twin boys were born premature, 7 weeks premature, and it was 1.9 and 2.1 kilos at birth. And they were in Werribee Mercy neonatal for another 7 weeks. And the way that they cared my children, and that's the reason why they are healthy after 12 years. My elder one was a full-term baby, and again the C-section was epidural, and then he was so healthy, and then the section all the procedures went really well. But again, the people who were having trouble, who were having problem in their delivery, we need to give them special care, and that's what this multicultural community hub for maternity is going to do. So the launch today that have happened today is trying to get this project to get a bit more interest or a bit more audience, and then giving them an idea what we are going to do. So I would like to share with the audience who were the distinguished guests appeared today and discussed and shared their valuable thought with this fundraising event. It's a great bunch of political leaders were there and were sharing their commitment to this particular project. So the guests including the Victorian Parliamentary Secretary for Women's Health, Cat MP, the Parliamentary Secretary for Multicultural Affairs, Ivan Walters MP, the Victorian Shadow Minister for Health, George MP, the Mayor of City Wyndham, Mia Shaw, the President of Federation of Indian Association Victoria, Vasan Srinivasa, and the founder of Indian Women in Australia, Reena. Rina Rana. And those are the people who were joined today for this fundraising. And how did I hear about this? That's an interesting story. I helped with a couple of great people. I would say a great couple who love to do something great for this Wyndham Mercy Hospital. And then last year, I supported this couple to do something great. And this time, Maria Di Mello actually reached out to me to find out more about this one. So I'm really grateful for Maria and the team, and especially the project partnership lead, Mark, doing this great thing and then helping Indian mothers and Indian community to have a better time during their very special moment of receiving their babies and going through that maternity trouble. So this is a request for you to come and check with the authorities, Werribee Mercy, to find out what is this hub and how this can be utilized for your Indian communities and your multicultural community. And if you are a leader who want to know more about this, please connect with me, and I will be connecting with all the right people, and that will be very useful for your community, giving them an assurance that the life is safe in Wyndham, and then you can utilize all the services in this maternity hub, and then find out the recurrence of meeting the maternity people and the treatments, the way that checking on 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 yourself and your baby during your maternity, and whatever the other things connected to the mental health during this period. We all know that postnatal issues and prenatal and all different mental health issues in the family during this pregnancy, and looking after the babies in different ways. So this is a great opportunity for our Wyndham residents. So shout out to Maria and the whole team who is doing this wonderful opportunity as a free voluntary time from their life, and they are so passionate about Wyndham, and especially for Mercy Health. So I will be sharing this again with our community and invite you to come and know more about this hub, the multicultural maternity hub that is starting in Wyndham. Yes, in the Werribee Mercy Hospital. So invite you to come and have a look at this great initiative, and grateful for all the people who working hard behind the scene for this great initiative. This is Bismi Palati on 88.9 FM, your favorite channel on Dominus Nisi.